Can ear infection fluid cause long-term hearing loss? Imagine a child playing happily, then suddenly struggling to hear their favorite sounds. Sometimes, this happens because of fluid buildup in the middle ear from ear infections. When an ear infection occurs, fluid can collect behind the eardrum, a condition called otitis media with effusion. This fluid can block sound from passing through the middle ear, leading to temporary hearing loss. Usually, once the infection clears or the fluid drains away, hearing returns to normal. However, if the fluid stays in the ear for weeks or months, or if infections happen repeatedly, there can be more serious consequences. Persistent fluid can cause changes in the ear's structures, like scarring of the eardrum or damage to the tiny bones that help us hear. These changes can lead to long-term or even permanent hearing loss. Damage to the middle ear bones, called ossicles, can interfere with sound transmission, causing what is called conductive hearing loss. In some cases, if the inner ear or auditory nerves are affected, sensorineural hearing loss can also occur, which is more serious. Children are especially at risk because their ears are still developing. Ongoing hearing problems during critical periods of speech and language development can delay a child's ability to communicate and learn. Chronic ear infections and fluid buildup can also interfere with how the brain processes sound, further impacting speech and learning skills. It is important to understand that permanent hearing loss from ear infections is not very common. The risk increases if infections happen often, last a long time, or are severe. Proper treatment by healthcare professionals can help prevent these problems. Treatments may include antibiotics for bacterial infections or procedures to drain fluid if necessary. Early diagnosis and management are key to protecting a child's hearing and supporting healthy development. In summary, while fluid from ear infections usually causes temporary hearing loss, persistent or recurrent infections can damage the ear's delicate parts and lead to long-term hearing issues. If a child shows signs of hearing difficulty, it is essential to see a healthcare provider promptly. They can evaluate the situation, recommend appropriate treatment, and help prevent lasting damage. Always seek professional medical advice to ensure the best care for children's ear health and development.